So, no, I wouldn't say I have a passion for HR.
Welcome back to Human Resources for the People. It's a human capital
Today we're going to be
revolution.
talking about a walkout taking place at Walgreens and CVS. It's mostly among their pharmacy staff, and it started on Monday of this week, the October 30th, and is going to go through today, November 1st. There's been walkouts on the West Coast for the most part in Washington, Oregon, and so forth in September and October, but they haven't had a huge impact. This one is supposed to be a bit bigger. One of the organizers, Shane Jerominski, is saying that the organizers are overwhelmed by calls about closed pharmacies. The pharmacy staff is fearing retaliation, which is normal. Walkouts themselves are not protected, assuming that these pharmacy employees are pharmacists and they are managing staff. They're not really protected by the National Labor Relations Act, and we'll talk about that in a little bit because that's an important note. But so far, there's been no reprisal from leadership, which is expected, right? These are fairly highly trained professionals, and as a result, they have a lot of market power, right? It's difficult to become a pharmacist. It's difficult to become one. It's difficult to get the education. And as a result, they have market power, and that's what frankly, many individual union members don't have. They don't. Their labor has been, for the most part, commodified, and as a result, there's not a lot of market power. These pharmacy staff are a little bit different, right? They have high market power. They control. They're highly educated, and so they have a lot more say in how much they make and how much they get. And this is mirroring a long running. Kaiser Permanente had 75,000 on strike earlier in October. There are a lot of medical folks that are going on strike right now. There's allegedly been 25 store closures. We'll see on that. Walgreens is saying that there's only 2 closed on Monday and only 12 pharmacists, quote, walked out. But we have to note here, walking out is not the full picture. And while this is the what the media is running with, there may be quite a few sick outs, which is a more common tactic. For example, there was what was considered to be a quote illegal strike by the teachers union out in Las Vegas because they were doing selective sick outs. And sick outs is what it sounds like. They call in sick and they notify their boss, and obviously they're missing from work. And as a result, the pharmacy may or may not be able to run. And I think that that is a more widespread function here that's safer, frankly, for the pharmacists who do not have the protection of the National Labor Relations Act. We'll still talk about that in a bit. But these because the pharmacists most likely don't have protection under the National Labor Relations Act, sick outs are a much safer and cleaner way to protest these policies and to protest the company. United Food and Commercial Workers International Union said it's supporting the organizers planning a walkout, and it says that they've been communicating with the CVS and Walgreens workers. They do have the largest retail pharmacy union. However, it's important to note, and again, we'll talk about it, many of these pharmacists are not covered under the National Labor Relations Act. Healthcare workers are, the Renee Saldana, the press secretary of UHW West Health, is saying healthcare workers and consumers are experiencing unprecedented strain caused by understaffing by healthcare corporations. Now, I'll remind you that Walgreens on August 3rd, 2021 required the jab for support office team members and required that all U.S. support offices will be fully jabbed by September 30th, 2021. So, that is intentionally eliminating staff that could be used to perhaps solve this understaffing crisis. No word if that's still in effect, but undoubtedly it drove people away from the group itself, away from the organization itself. Walgreens and CVS representatives are saying that they haven't seen much disruption from these pharmacists sick out there. They quote, "We're committed to providing access to consistent, safe, and high quality healthcare to patients and communities they serve." And they're engaging in a two-way dialogue with the pharmacists to directly address any concerns they have. But the reason what the concerns are is that they're not getting sick leave. They're severely understaffed, no lunch breaks, and apparently are working solo 14-hour shifts. I'd be curious at how frequent that is, how common and how widespread they're being overworked. Again, these pharmacists have a lot of market power. They can make decisions and sort of move the needle. They have the ability to get a job elsewhere, and I think that that's interesting because it's quite different from a lot of other people who have struck in the recent last couple weeks and in the last couple years. So I wanted to talk real briefly about the National Labor Relations Act because there is a management provision in it. There are groups that aren't covered under the National Labor Relations Act, like accountants, farm workers, families of employers, government workers, etc. And most importantly, for these pharmacists, they're not protected potentially because they're managers and supervisors, and so they can't join unions or be part of a bargaining agreement. And so that's the nature for most of these pharmacists, as I understand it, is that these pharmacists are acting as supervisors, and as a result, do not have labor relations rights. They are acting, quote, independently for this particular action. So what have you seen in your area? Have you seen people striking at Walgreens? Has it been an issue with you getting medication? Let me know in the comments down below. Like, share, and subscribe, and we'll see you on the next video. Bye, guys.